Hi, I'm Erin Alberty. I'm with the Salt Lake Tribune, and I'm here with Annie George, an epidemiologist with Salt Lake County. Thanks for joining us today, Annie.
Sure.
We're going to be talking about the sort of trends and patterns in the spread of coronavirus in Salt Lake County today. And lots of questions, of course. I think starting with, we're in the middle of a pretty big surge, and it's not the first time that we've had a pretty big surge. This was bigger than we experienced this summer. Just kind of looking at more of a micro level within our county, is the current surge looking different from the surge this summer in terms of kind of who it's affecting? Is it affecting different neighborhoods, different communities, different income groups, different racial and ethnic groups? Is it spreading through the populations in different orders? Can you tell us a little bit about how things are going differently this time than last time?
Sure. So this most recent surge started kind of towards the beginning of September, and we saw it really take off when, so I think there were two contributing factors. One, the Labor Day holiday, and two, when kids went back to school. So the first kind of the thing that kickstarted this latest increase was people were younger, and now we've seen it over the last month move into the older population, which we saw that the first time, but the thing that's different about this time is the increase in cases has happened much more quickly than we saw last time. So for example, our 7-day average incidence is the curve is much steeper, which is of great concern for many reasons. We've seen a real increase in hospitalizations. Last week was our highest count of hospitalizations in Salt Lake County that surpassed even the peak that we saw in July. So that's very concerning for a lot of reasons.
Now, with hospitalizations in Salt Lake County, are you seeing the hospital occupancy and the intensive care unit occupancy being higher than the statewide figures that were given?
So, yeah, I'm not super familiar with all of the statewide data because I primarily focus on Salt Lake County. So I can say that our bed space is become very limited, but even more importantly than that, the directors of the healthcare systems have tried to raise awareness to the fact that there's a great deal of healthcare worker burnout going on right now. So the fact that there are beds available doesn't really contribute as much to the problem as that we don't have healthcare workers to be able to care for these people because of the intense amount of burnout that's happening right now. So that is of great concern. They've been trying to raise awareness about that for the last several weeks. So that's something that we're very concerned about because our healthcare workers are a precious commodity, right? We can't just open up a job fair and be like, okay, who woke up this morning and felt like being an ICU nurse? It doesn't work like that. So we have to be very careful, particularly where we are headed into respiratory disease season. So we've got flu and RSV that could potentially provide some sort of a trifecta that we don't know what's going to happen. So it's very common, for example, at the very beginning of COVID, in January, when we first started having talks with our healthcare providers and our healthcare partners, they told us that they were very scared because the beds in the ICU were already at capacity, and that was just from flu and RSV. So adding a third disease on top of that is obviously of great concern. So we're very worried about that, which is why we're encouraging people to get their flu shots and continue doing the things that we've asked people to do all along. So make sure that you're wearing your masks, make sure that you're social distancing, all of these things to help decrease the burden on the healthcare system.
Now, I'm not sure about the level of contact you have with the healthcare systems that operate in Salt Lake County, but have you heard about circumstances where they have had trouble placing a patient, either with coronavirus or with some other malady, that they don't have room for them, or they have to hunt for a hospital that does?
We're fast approaching that. So I know the two largest healthcare systems in Salt Lake County are very concerned about that they are moving into what they call surge capacity. So trying to figure out what are we going to do when this gets worse, because the number of hospitalizations that came in over the weekend was incredible, and that's what they keep telling us. We don't have room for these people. We don't have people to provide care for these people. So that affects not just health of caring for coronavirus patients, but all across the board. So it's a real concern.
Okay. Yeah. I know we've been hearing a lot from the healthcare providers about it, and just kind of wondering where the tipping point exactly is. Is it tomorrow? Is it today? Was it last week? Not quite sure, but it's, I think that it sounds like, it's getting really busy. And I know the first surge, which wasn't this bad, and the hospitalization numbers never got this high, caused a lot of, stress among healthcare providers. I've spoken with, doctors and nurses who just start crying as soon as they start talking about what happened this summer. And that wasn't as bad as what's happening right now. I'm not sure everyone understands that. We do have a question from Mia on Facebook. How are we watching for reinfections? I know we had this case in Nevada yesterday kind of being widely reported. Is there genetic testing for positive results to see if they have unique DNA with a second case? How does this work? And what, if anything, are we doing to identify if this is going to be a pattern and so on?
Sure, that's an excellent question. So we are watching for that. Our state lab is trying to get to the point where they can do the genetic testing to test for reinfection. We have had people that have tested positive. The kind of the baseline that we use is if they've tested positive twice if it's within the same 90 days, we count that as the same infection. But if you're outside of that 90 days, then it's counted as a new infection. So that's kind of the general guidelines that we're going off of until we understand a little bit more. But the state public health lab here in Salt Lake County is working towards being able to do genetic testing like that to test for reinfections.
Have we had any
people that have fallen in that category, but we don't have the genetic sequencing to see if it was just carryover from the first infection or whether it is indeed a second one. So they're working on that.
Sure. Okay. Well, that's interesting. I know that we're all have gotten increasingly curious since yesterday about that possibility, and it's been a tracking possibility to contemplate. I know that the last surge in Salt Lake County, it appeared to start settling down about 2 weeks into July, which was also about 2 weeks after the county implemented a mask order. Now, we still have a mask order, but cases have risen even faster, as you said, than they did last time when we didn't. So can you tell me, what do you make of that? Is there concern that masks aren't working as we hope, or that people aren't actually wearing them as they are supposed to? What have you been able to find out about it?
Well, from my own very professional research of observing people at the grocery store, I would say probably a lot of it has to do with how people are wearing their masks. They're either not wearing them at all or not wearing them correctly. So on social media a couple of weeks ago, there was an incorrect mask bingo card. So you're supposed to check off all those, and yes, and I can say that every time I go to the grocery store, I can get blackout on all of them because I've seen them all. So it's super frustrating. You see people with their noses poking out and stuff like that, and you're like, come on, I get that we're all sick of this, but we have to work together to be able to get this problem under control. And giving a half-hearted effort or not using one that's appropriate for what it's intended for is not going to help anybody, and we're just going to be stuck in the same thing. So I think I don't think that's the only issue. We've opened up different things, so people going back to dine in at restaurants and they don't have their masks on the entire time, obviously because you can't eat with a mask on, but things like that. I think as things have started to open back up and people have gotten lax in their wearing of masks, I think that's contributed. I know something that we've seen kind of interesting out of our first month or so of school data. The cases in the schools aren't occurring so much within the classroom where the kids are wearing masks. It's in extracurricular activities where they can't wear masks. So we think that that's also contributing as well. Okay.
Well, that's interesting. I didn't realize that that's where you were finding the school cases. We just get the numbers, but they don't say they got them. Extracurriculars are facilitating the spread of coronavirus. Is it sports or music, or what's the
largest offender we've seen so far is sports, and I don't have exact numbers for you, but it is something that we kind of caught on to, like, oh, there's the football team and the cheerleaders over at the football team or the football game and different volleyball games that we've seen. And it was kind of interesting. We talked about it on a statewide call a couple of weeks ago, and that was a common consensus. But we've seen a lot of cases in extracurricular activities, particularly sports.
Now, I mean, football is an outdoor activity, and this is one of my questions that I did kind of want to ask about. I feel like we're getting kind of mixed signals from a lot of different sources as to how safe certain types of interactions are. And one of the things I really want is, I think people put a lot of confidence in, well, if something's outside, it's probably okay. But then we also kind of reflexively balk at seeing Senator Mike Lee like kissing and shaking hands with and hugging a bunch of people on the White House lawn. So I guess what is the rule? And if something's outside with the football players, even the cheerleaders who don't presumably mostly share a locker room with the football team, are getting like amounting to pressure. What's going on outside that's allowing that to happen?
Yeah, so what we kind of think is it's not necessarily happening during the game, but perhaps after, where maybe everybody's in the parking lot not practicing social distancing, the masks are off, stuff like that is our growing theory. A lot of them, whether they during practices or whatnot too, will kind of congregate. We've heard from parents that have called us and things like that. So we think that's contributing. Outside is tough, so it is better. There is better air ventilation and better air movement, but we still encourage people to practice social distancing. You've got natural air movement on your side, but it's always safer to practice social distancing to make sure that you're not creating an environment where you could potentially contract the virus as well. So
sure,
social distance, inside, outside, anywhere you are.
No, I guess this kind of leads me to a question that I'm sure my 7-year-old daughter thinks is the most pressing coronavirus related question, which is, what are we supposed to do about Halloween? We've been getting, I know the CDC put out guidance pretty stringent, recommending against trick-or-treating entirely. The governor has referred to perhaps some alternatives. Even the CDC objected to like trunk or treats, things that are smaller, not the whole neighborhood and randos come to your house. And I don't believe I've heard anything locally as to what the plan is. So, and I know my neighbors have been asking me and each other what we're doing. And so I guess, what would you recommend?
Yeah, with the case counts being what they are right now, I would recommend holding off this year. And I know that's hard. I know it's a big celebration for a lot of people. It's a lot of fun. The kids love to dress up and go trick or treating. I don't think the county's come out specifically with guidance along those lines, but just from the numbers, I'm very against creating environments that could potentially fuel the spread of a virus right now, where we're already seeing case counts as high as we are. So I would recommend holding off this year.
At least for like the sort of public throw your yard open and have everybody in the neighborhood swing by there. So you're not going to be putting out a bowl or anything for it's going to be porch light will not be on. So one thing I'm wondering about, kind of going back to adherence to the mask order, is there any, I guess, quantitative information about like adherence levels to our mask order, or it's either the one that applies to the schools or the countywide one? Has anybody gone out with like a clipboard and mask, no mask, or is there anything that we have that shows us how well we're complying and how well, for example, businesses, employers, merchants, whatever, are enforcing it in their own private enterprises?
Sure. I know that's something that's being worked on. So both at the state level and the county level. So we've kind of conducted a few unofficial studies of as several of us have gone about throughout a weekend. Places that you've gone, have they had a sign up? The businesses had a sign up that say that they require it. Is it enforced in the store, stuff like that? But it's not. I would not qualify quantify those results as official results. So because it said that we had pretty high compliance, but at the same time the state conducted a behavioral survey. They were just calling random people, not just in Salt Lake County but throughout the state, to see if people were complying with masks. And I know that's been ongoing. Every now and then they'll give us an update of now we've hit a certain threshold with this, or not threshold, but hit a certain number of people that have responded to the survey, and this is what we found so far. So I know I haven't looked at it for the last couple of weeks, but it is available on the state health department's website. But I know like women are more likely to wear masks than men. There were right. That's my but in terms of overall, compliance with the mask mandate, when they did divide it down into city, I think it was like 80 some odd %, but that was kind of towards the beginning. And I know that they've done additional surveys. So, but it is something that we're looking at. It's just kind of an ongoing process. So.
Yeah, I know that must be pretty hard to collect data, and there are a lot of places where people are gathering that aren't just visible to, who's there, and who people won't remember what they did or what they saw.
Sure.
Now, have you noticed any patterns in terms of the sources of exposure this time around? Are you seeing is it still just a bunch of household infections? Are you seeing more workplace infections? More unknown or community spread cases? What have you been seeing this time around?
So it's actually still largely within the household. We were talking about that on a call this morning, that people are still aware where they're getting it from. So large part household, large part workplace. So there's still, there are, when you get case counts this high, there are several people that are like, I have no idea where this came from. And that's expected when case counts are this high, but a lot of people are able to track where they know that they got it from. So I would say workplaces and households are probably our top two.
Sure. Okay. Now, in terms of contact tracing, we're seeing so many cases now. How long is it taking to complete contact tracing for a single case?
Yeah, so that's one of the struggles that we're facing right now. When a contact tracer gets about 5 new cases every day or so, it's very hard to stay on top of it. So it's taking longer to notify people. Presumably they would have been notified by wherever they were tested at. But in terms of getting hold of people and being able to collect information from them, it is difficult with this many cases. So we do ask a lot of questions when we call and do contact tracing. That has its benefits. We have some of the better quality data than a lot of the states that have kind of thrown in the towel on doing contact tracing, and you kind of can't blame them at the same time, because it reaches a point where it's not effective, because you can't, unless you have a whole army of people to call cases, then it doesn't do you any good if you're calling them after they've already been off of quarantine for a while. So it is definitely a struggle. Depending on the person, I think they're kind of estimating it takes a couple of hours to do contact tracing for one person. So
for one interview, or for everybody that you have to call after that person.
So the interview, from what I've heard from people, usually takes about an hour, and then it takes a while to put all of that data into provided they're cooperative. But it takes a while to get all of that data entered as well. So we're having to make some changes. A lot of contacts, we are encouraging the case to notify themselves, because we can't keep up anymore if every case has got 4 or 5 contacts, and that just drags on the process for a good length of time. So we are encouraging people to notify their own contacts, and that's helped somewhat in terms of workload burden on our contact tracers, but they're still very busy. We've I don't even know how many we have total right now, but we keep hiring more to come help out, because the health department itself pre-COVID could not by any stretch of the imagination handle the case count and doing the contact tracing that is required right now.
Now, are there a lot of cases where the health department isn't contacting forward, like the people that the infected person had contact with? Is it likely if I had contact with somebody who's been infected that I'm not going to get a call from the health department now?
So it depends on where the contact took place. So we're focusing on household contacts. We've had to do that for a while, just for sheer case counts. But we do notify workplaces, and then it's the responsibility of the workplace to notify the employees. So if it's at a workplace, then yes. So it just kind of depends on where the exposure took place.
You mentioned the caveat that if a infected person is cooperative, and I know that I'm hearing that in other states, I think particularly in North Dakota, which is having the highest incidence rates right now, that contact tracers are finding that some of the people who have been infected do not want to participate in this. Have you, I mean, has Salt Lake County encountered this?
Oh, yes, all the time. So it just kind of depends. And I think how some people view it is that they should be ashamed that they contracted this virus. And that's not the case at all. We're not, calling to reprimand you by any stretch of the imagination. We're, the only goal that public health has ever had is to try to get this under control. So we're not, calling to make someone feel ashamed that they got it. Because it happens, it happens to people that are wearing masks. It could happen in a variety of ways. So that's not the goal of that. We're trying to, to get information so that we can, notify individuals if they have been exposed and just kind of help us out with data collection. But we have run into that. A lot of people won't be entirely honest with us about places that they've been. This was particularly true when things were shut down, underground parties that were happening and nobody wanted to spill the beans that they'd been somewhere or things like that. It's a little bit different now that things have opened back up, but that's, like I said, it's not the goal of us to try to shame anyone that has contracted this virus. We're not putting the blame on you. We're just trying to get information to figure out how we can help stop the spread to other individuals.
Okay. So is it mostly people are just kind of sheepish about it, or are you also having people who object because they just don't think it's a big deal and you shouldn't be asking them?
Both. So some people are still very much convinced that this is a conspiracy theory that is not a thing, and so they won't cooperate. We've had parents at schools that won't allow their kids to be tested, things like that we've run into. We've heard of this, and this is very disappointing to me that we've had school administrators as well as like football coaches that we've heard of or other team sports that have told kids not to get tested so that they could continue to play, which is very, I'm very passionate about that, but and how irresponsible that is, because these kids go home to families and grandparents and things like that. So we've run into a fair amount of that, and it's very disheartening, honestly. So
wow. Can you tell us a little bit about some of the largest clusters you've encountered in terms of gatherings or events or groups in proximity? I mean, I know there's been a significant outbreak at the Utah State Prison, for example. But what other things that any super spreaders or any large groups that all kind of come from the same situation?
Yeah, so it's the super spreader events are kind of hard to track, and we're having a hard time keeping on top of that right now with the case counts being what they are. Workplaces, we've seen some workplaces, and it kind of depends on what I think is most fascinating is to look at the type of workplaces. So maybe not so much in an office setting, but construction workers, that's from the very beginning has been a place where we've seen it spread very quickly. Or like shipping and receiving or assembly line kind of things where people are working very closely together. I think those are probably the biggest instances that we've seen that we can, track directly to or trace directly to workplaces. But yeah, like you said, the Utah State Prison is probably our largest outbreak to date. I think as of yesterday, they had like 260 some odd cases. So that one spread like wildfire. It's kind of the same scenario that we see within long-term care facilities as well. So those are very scary as well, because it gets in there via a healthcare worker or someone that's going to work and starts to spread to the residents and gets out of control very quickly. So
with looking at construction and shipping, these sorts of work environments, is it the environment or is it more the nature of the work being like it's manual labor, you're breathing a lot, mask wearing is a little less sustainable than it is like in an office where you're just sitting quietly at your desk?
Sure. I think probably both of those things contribute. We haven't, looked at it specifically, but I would say just knowing what we do about the virus, that both of those things probably contribute very heavily to it.
Sure. I mean, have you seen like even just like family parties or anything like that? I mean, I know people have been that's kind of always been pointed to as sort of like if you're partying with your friends, if you're having fun with your friends, then shame on you for being selfish and everything like that.
Sure.
Of course, there's also like costs to isolation, and so I think people are trying to strike a balance. And wondering if you've seen a lot of like out of household social happening.
Sure. One place that seems to have been a hot spot is people vacationing at Bear Lake this summer. So I saw a whole lot of cases of family reunions and things that had been to Bear Lake, and that seemed to be a real hot spot. We saw that enough that I picked up on it in the cases that I looked at. So I know there was one family reunion, and I don't remember the exact numbers, but I think all of them got sick.
Wow.
Yeah. So.
Wow. I know that. Go ahead. I'm sorry.
Oh no, you're fine.
I mean, I've seen some pretty compelling arguments for some more aggressive, like backward contact tracing. So, like when you have an infected patient, rather than focusing on who they've had contact with since they got sick, you try to look back and see where they got it from, and that way you can maybe identify some of these people who tend to spread it to a lot of people. Because it sounds like there's more and more evidence that like you'll have these situations where just like a ton of people, like at a church service in South Korea, get it, and then other places that are kind of similarly packed that there may be somebody there, but they don't spread it to anybody. Hairdressers, and with Missouri, and they were masked. But is this something that Salt Lake County has been focusing on from the beginning, or are you changing how you're approaching contact tracing? Because I mean, the argument is that it's more efficient, more with contact tracers' time, if they can identify where somebody got it from and then reach out to everybody who was like in contact with that person or in that event, as opposed to trying to reach 20 or so people, depending on whether they're working or not, that they may have been in contact with since like they first developed symptoms 3 or 4 days ago.
Sure. That was easier to do at the beginning when we didn't have as many cases. So the very, the first few cases we had, we told people, sit down with your calendar, get your bank statement out, anything like that could tell us where you've been in the last 2 weeks to help us, pick up on that. Now it's, yes, we ask, but unless people are really, really involved with looking at their calendars and things like that, it's kind of hard to pin it down. Some people will flat out tell us like, oh yeah, I went to a party and now all of us are sick, and you're like, oh well, but it's gotten a little bit more difficult as time has gone on, and it just kind of depends on the contact tracer too. How thorough the questions they're asking are. So. It's gotten a little bit harder. We were better at that at the beginning. We could pretty much until we hit about 50 cases or so, we could tell where everybody had gotten it, either from travel or exposure to a family member. But now, sometimes we'll make connections, but it's gotten more difficult.
Are we getting to that? I mean, you described other states kind of throwing in the towel on contact tracing because it just got to the point where it's diminishing returns the more cases you have, and it's unrealistic and it's not effective. Are we there, or are we there later this week? Are we there next week? How's the contact tracing going to continue if that's what everyone else has concluded?
Yeah, so it's being discussed right now because our poor contact tracers are burned out. So I don't have an exact answer for you. I know Utah County kind of threw in the towel when they were seeing the outbreaks down at BYU and UVU. They threw in the towel for a time, and they're going to start picking that up now because their case counts have come down. So I'm not sure exactly what our leadership will decide to do, or we've kind of cut back as much as we can, not contacting every person that this individual has been in contact with. So I know they're trying to come up with some sort of a modification of not doing it, like not just completely throwing in the towel, but some sort of a compromise in the two, so we're not just throwing in the towel, but still trying to do some sort of contact tracing.
Sure, sure. Well, this has just been so interesting, Annie. I know that it's been a crummy couple of weeks in your field, and I'm sorry. I wish things were getting better. Hopefully they will, but this has just been really informative, and I think that it's given our viewers and readers a lot to sort of think about how to strategize their participation in prevent further spread. So this is just great. Thank you so much.
Yep, you're sure welcome.
All right, take care.
Okay, thank you.
Bye.
Bye.